Okay, we're back, and the second half of Ray's question was talking about residency programs to become a physician and the rate of depression that might exist in that, and they were highlighting that. When I was a resident, we were on call for every other night, I think it was, for basically 36 hours. So we were report to work at 8 o'clock in the morning. We would see patients all day in the hospital. Then we'd be on call all night, admitting patients, usually very little sleep, and then working all the next day up until closing time. And then you would get off and go home, and then you have a normal day. And then the next day you would basically be on call again at the hospital, handling all the admissions and all of the things. And that it was a very grueling schedule, but you weren't alone, but it taught you how to think under pressure, and certainly how to function with very little sleep. And I suppose back in that particular time, it was probably very appropriate. The hospitals were busy. People were being admitted to the hospital for being sick, but they're also being admitted to the hospital for really workups, and they don't do that anymore. And some of the people might remember back in the day in the 80s where you would basically be admitted to the hospital for just a general checkup. Their doctor would put you in there, and he would have his office attached to the hospital. He would make rounds in the morning, and then he would see patients in the afternoon. And that used to be the standard protocol. Then Medicare changed all of that in 1980, I believe it was 86, 88, somewhere around in there, where they changed it to what they call the DRG, or diagnosis-related groups. And we spoke about that briefly on a previous segment with Kelly Adams from the hospital, and the hospitals got paid based on the diagnosis after the patient was discharged. So, money talks and what walks. So at that particular point, the census, or the amount of patients that were in the hospital, dropped off in half. And therefore your workload dropped off pretty substantially too. And the benefit of being up all night and thinking under pressure didn't really have as much of an impact on that. And now medicine has become so specialized that unless you intend to go into a learning situation or a tertiary care hospital, it's very unlikely that you're going to get a call in the middle of the night and have to answer those particular questions. Now everything is so segmented, meaning patients don't even call you. They just go to the emergency room. They call the ambulance service. They call this, and you as a primary care doctor find out about it way after the fact. You're trying to play catch up to catch records and do things of that nature. Speaking to the fact of depression and all the other things that happen with that, I think it's an individual thing. I think that people that are coming out today of medical school and training probably in general aren't really so-called, we're conditioned to be able to think, oh, well, I'm just depressed, and I can't do this or I can't do that. And before, we just suck it up and get it done, and that's basically how you survive. And now it's all a feel-good society or a feel-bad society. I'll come back to this in a minute, but we have Chuck on the phone. Chuck?
Hi, Doc. I bought that book you recommended, Treat Your Own Back by Robin McKenzie.
Oh, good.
Yeah, and it's superb. And by the way, it cost a grand total of $5. I bought it used, but it's in perfect condition.
Yep.
Anyway, regarding the first issue Ray brought up with the lady with the problem with the back, in the foreword of that book, Treat Your Own Back, it talks about how much more prevalent back problems and leg problems are in the so-called civilized society as compared to the third world countries. Mm-hmm. And it attributes the problem to the common prescription by doctors in the West to take it easy if you have a back problem. And they say how people in the third world never do take it easy, and they don't have doctors, basically telling them that. And they attribute that in the book to many of the problems we have with back and leg issues. And I just thought it fit in perfect with what you were talking about, the bed sores, and how circulation is such a vital part of our ability to heal ourselves, per se.
Oh, very true.
Okay, I'll hang up and let you go with that one.
Okay, thank you. And certainly that's very, very true. I had one patient today earlier who basically had a sore that had developed on top of his foot, probably from maybe wearing a shoe too soon from a toe infection that came out of nowhere. And circulation and the ability to get oxygen to our tissues is extremely important. We are oxygen-based organisms, and so we need oxygen for healing processes. We need nutrients. We need blood flow. And when you don't get that, things do break down. And so, and the other part of it too is, when your back hurts, weight is one of the big issues that constantly pulls at our back. We're a very sedentary society. We drive a lot. We sit, we watch TV, we're not very active, we get very little exercise, and we suffer the consequences of that. We are a consumption-based society. And there was an interesting graph that shows how somehow obesity, I actually saw this, I could put it up on the show, but around 1970, we just see the epidemic of obesity just start to take off in this upward trend. I mean, look at the children today. A lot of them are overweight, and they're sitting there with their Game Boys in front of their TVs and their phones, and they're not doing anything. And in the day when you didn't have those things, you were outside playing, you were moving around, and you kept yourself active, and everybody was thin, and all of a sudden now we become a sedentary society, and that, in as much as a damage as much as anything, is what we're doing today. And I think it's very important for you to always be active, and that's what I talk about a lot on the show, which is being active after you eat, which really will prevent a lot of weight gain and a lot of diabetes. Louis, good evening.
Yeah, hey Doc, how you doing?
I'm great. Thanks for calling.
Listen, I got a buddy of mine who lives in Phoenix, and he's got psoriasis, and he's been going to doctors and all kinds of stuff, and he's been taking all kinds of medication, and he said that sometimes it goes away and sometimes it comes back, and he don't have a clue how he got it to begin with, and he don't have a clue on how to get rid of it. Could you help me out a little bit?
Yeah, that's a good topic. Psoriasis is an abnormal division of the skin. It divides extremely rapidly, and as a result, it becomes, I don't want to say it's an autoimmune disease, but it kind of fits in that psoriatic arthritis thing. So some people with psoriasis can develop arthritis as a result of this combination. But psoriasis is an abnormal division of the skin, and it can sometimes become red, inflamed, and it can be obviously scaly. It's usually on the extensor surfaces of the body, which means the extensor, which is the thighs, down to the sides of the legs, and on the arms, or the elbows, and those particular tissues. Basically, it is treated now with basically immunosuppressive agents. They'll use some Cellcept and some other harder line drugs to treat it, which to quiet it down, especially if you have a very severe case. One of the old products that I used quite substantially was a tar-based shampoo. Seems to help, especially if you have it in your scalp, and some lower deviants of that, but derivatives of that, such as seborrheic dermatitis, or even a little bit of a dandruff, can be somewhat in that same category, even though it's not the same disease. And I remember when I was younger in medicine, we pulled out anthralin, which is a very tar-based. So tar-based shampoos and tars, for some reason, have a quieting effect on it. And there's a guy, and we bathe them in anthralin and put a tube gauze on them, and it actually dried it up quite nicely. We used to use a lot of cortisone for it, and I don't like cortisone for psoriasis, even though that's one of the things some people use, because the cortisone gets absorbed into the body and it can suppress your immune system a little bit more. Remember, you've got kind of an autoimmune revved up, increased division of tissue, which causes redness, erythema, and scaling. No known virus. It seems to maybe linked to, believe it or not, allergies when you're a kid. For those people who have asthma when they're young, may develop, a lot of them will develop psoriasis as they get older, or some other skin disorder. So your friend Louis may have had asthma as a child, outgrew it, and then developed psoriasis later in life. And usually what people will do is they'll get in a hot tub to kind of a hot tub can be very helpful for psoriasis, not from the chemicals, but it can soften the scales and help it become more manageable. And I can't really decide which is better, to be taking cortisone, which I know thins the skin and causes diabetes and all the other problems, or some of the immunosuppressive agents, which actually slow your immune system down and make you more susceptible to other infections. So I like the tar-based. They're smelly, they're greasy, but they don't seem to affect the immune system. There are some UVA, and people have been put in ultraviolet light. Being in the sun can be helpful. Seems to be more of a winter prominence for the disease because we probably don't get as much sun. So vitamin D may be very helpful in some cases. And I think they used to make a vitamin D cream that worked quite substantially. Very expensive, but there was a vitamin D cream for some severe cases. So a lot of different treatment options out there. I would suggest that if you're considering they can't get it under control with basic stuff, that they see a rheumatologist or a dermatologist who specializes in psoriasis, and they might be able to give them a hand. Doesn't imply that they have a vitamin D deficiency. I just know there was a cream out there that was very helpful. So we're going to go to break, and I appreciate you callers, and we still got 30 more minutes, so get those calls in. We'll be right back. Thank you.